Does the RSV vaccine improve health outcomes in older adults? What are the guidelines for reporting observational studies? And the launch of JAMA Plus Women's Health, where clinicians can find the latest information on women's health. This and much more on today's JAMA Editor's Summary. Hello, and welcome to our listeners around the world. Today is Friday, September 5th, 2025. I'm JAMA Deputy Editor Dr. Linda Brubaker, sitting in for Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief of JAMA and the JAMA Network. For this episode, I'm joined by JAMA Deputy Editor Dr. Preeti Malani. Hello, Preeti.
Hi, Linda. Things have been busy at JAMA this week. The European Society of Cardiology Congress, the ESC meeting, wrapped up earlier this week. A lot of impactful work presented at the meeting was concurrently published in JAMA and the JAMA Network. Information on each of these studies from across the network can be found on the JAMA ESC website, and that landing page is linked in this podcast's show notes. And don't miss the special edition of the ESC Editor Summary podcast, also linked in the show notes.
Preeti, could you get us started with a brief overview of some of the ESC work?
JAMA published 2 articles about outcomes after RSV vaccination in older adults. First up, from Dr. Lassen and colleagues, was a pre-specified secondary analysis from the DAN RSV trial, which reported that all-cause hospitalization for any cardiorespiratory issues in adults 60 years of age and over was significantly lower among those who received an RSV vaccine. In this case, it was the bivalent RSV Prefusion F protein vaccine, compared with those not vaccinated against RSV. And this was a very large study that included more than 130,000 participants from Denmark. And Dr. Suri and colleagues looked at durable protection of RSV vaccination to prevent RSV-associated hospitalization among U.S. older adults aged 60 and above. Using a test-negative approach, they compared the odds of having received RSV vaccination among nearly 7,000 older adults hospitalized for acute respiratory illness during the 2023 to 2024 and the 2024 to 2025 seasons, and they concluded that one dose of RSV vaccine prevented RSV-associated hospitalization during 2 RSV seasons. However, they did report that effectiveness was lower in patients that were immunocompromised or those with cardiovascular disease.
Well, that's certainly relevant for clinicians. Drs. Chu and Murray discussed these 2 papers in their editorial, emphasizing that, quote, recognizing these broader impacts underscores that vaccination is not simply a tool for infection prevention, but an intervention that is also capable of shaping outcomes in cardiovascular health, unquote.
And Linda, there's more. As our listeners know, Semaglutide and Tirzepatide have emerged as popular medications to treat obesity and diabetes. Dr. Kruger and colleagues used data from 5 cohort studies to investigate use of these drugs in patients with cardiometabolic heart failure and preserved ejection fraction. They found that both medications, compared with sitagliptin as a placebo proxy, were associated with reduced risk for a composite outcome of hospitalization for heart failure or all-cause mortality. Let's hear more about this from JAMA Executive Editor Dr. Greg Curfman.
The investigators were using observational data, and they were emulating clinical trials, not actually conducting de novo randomized clinical trials. So that was the principal reason that we were interested in this work. Some investigators don't really have a lot of confidence in clinical trial emulation, while others are interested in pursuing it as a line of research, since, of course, not every clinical question can be the subject of a randomized clinical trial. So we felt that these were interesting results, not definitive, but interesting, and it will be especially interesting to see how they compare when subsequently actual randomized clinical trials are conducted of these 2 drugs.
And it wouldn't be a cardiology congress without an atrial fibrillation trial. Dr. Kim and colleagues published the ALONE-AF randomized clinical trial. The investigators included more than 800 patients with at least one stroke risk factor and no recurrence of atrial arrhythmia for at least 1 year after ablation for atrial fibrillation. Participants were randomly assigned to either discontinue or continue oral anticoagulation therapy. The authors found that discontinuing oral anticoagulant therapy was associated with a lower risk of a composite outcome of stroke, systemic embolism, or major bleeding. The editorial by Dr. Gerstenfeld and Lee highlights the clinical importance of this study.
Yes, it's helpful to understand the potential benefits of discontinuing anticoagulation in this selected population. There were also 2 trials about myocardial infarction this week. Multivessel disease occurs in more than half of patients with NSTEMI. In the SLIM clinical trial, Dr. Pustens and colleagues randomly assigned patients with NSTEMI to receive either fractional flow reserve guided completed coronary revascularization or culprit-only revascularization. They found that there was significant reduction in composite of all-cause death, non-fatal myocardial infarction, any revascularization and stroke at 1 year in the fractional flow reserve guided revascularization group. And Dr. Hoffman and colleagues conducted the Help MI Sweetheart trial, a nationwide trial conducted in Swedish hospitals. The investigators used a cluster randomized crossover design to study H. pylori screening in patients hospitalized for a myocardial infarction. They reported that routine H. pylori screening did not reduce the risk of upper GI bleeding after an MI.
There is a JAMA research letter from Dr. Cherla and colleagues about cancer drugs. The authors looked at publication of clinical trial uncertainties, like unvalidated endpoints or limited long-term data for new cancer drugs. They used the Drugs at FDA database to identify approved cancer drugs from 2019 to 2022. They also searched FDA documents for uncertainties identified by FDA reviewers related to primary outcomes of pivotal trials, and then looked for proportion of these uncertainties reported in journal publications and guidelines. The authors concluded that journal publications and clinical guidelines infrequently reported clinical trial uncertainties highlighted by the FDA.
That's interesting information, especially since many clinicians rely on journal publications and clinical guidelines to make informed decisions about cancer care. There were several viewpoints this week about health policy. Doctors Howden and Hansen write about the One Big Beautiful Bill Act and the implications it may have for rural health care. And on the topic of rural health care, Dr. Mullins and colleagues propose ideas to improve and modernize rural health systems.
Yes, Preeti, these viewpoints are very timely, especially given concerns about upticks in rural hospital closures. Dr. Shakar and colleagues explain how executive orders modifying federal funding conditions attached to Medicare and Medicaid threaten gender-affirming care and physician autonomy. JAMA also has an exciting new announcement. This week, we are introducing JAMA plus Women's Health.
Linda, you've worked so hard to get this off the ground at JAMA. Can you tell us a little bit about what to expect?
Sure, Preeti, I'm happy to. JAMA plus Women's Health is an initiative designed to elevate women's health content across the entire JAMA network. Clinicians can bookmark and visit the carefully curated website that is dedicated to advancing clinical care across women's health.
And here's a clip of Linda sharing a little more about JAMA plus Women's Health.
For decades, clinicians have used the best available clinical evidence to provide care for their patient. A lot of those studies used men as their participants, and they excluded women, or women were very poorly represented in those studies. This limits the generalizability of information from those trials. And now with rigorous studies that include women, or focus exclusively on women, we have much better evidence. The clinical issues that JAMA publishes in Women's Health will all be collated on a single place, the JAMA plus Women's Health channel. This will improve discoverability and linkages for clinicians seeking specific information to improve the health care of their own patients. And I had an opportunity to speak with radiologist Dr. Moy on the JAMA plus AI Conversation podcast, co-hosting with Dr. Roy Perlis. We discussed what AI in medical imaging could mean for women's health. Here's a bit of that conversation.
Do the reports need to say this was read in part by an AI or we used an AI? In other words, is this going to be something that patients consent to, or is this just going to be so much a part of what you do day to day that it probably doesn't need to be explicitly disclosed?
That's a great question. And at least for breast imaging, we went ahead and use our prior reports. So breast imaging used to use something called computer-aided detection, or CAD. And back then, we always included that in the reports. This new AI is a little bit nuanced. So we put into reports, and I tell patients, I'd like to use AI to assist me, and usually they're interested. And I have to say, most patients are glad that we do that. I've had a few patients who mistrust the AI and said, you know what? No, thank you. I'd rather have you look at it or you and another colleague look at it. But I'm a big fan of transparency, so I always tell patients that we're using it.
There's a wide range of clinical content this week. Dr. Cashin and colleagues contributed a special communication about reporting guidelines for target trial emulation studies. The target statement uses a 21-item checklist to help clinicians and researchers report and interpret available evidence when a randomized trial may not be available or feasible. And there's a JAMA review this week on hypothyroidism by Drs. Checker and Papaliantou. They summarize clinical science as well as high-yield recommendations for treatment and monitoring. Tune in to hear JAMA Senior Editor Dr. Lasser discuss this review on the JAMA Clinical Reviews podcast. Here's a clip of their discussion.
Now, how do patients with hypothyroidism typically present?
So this is a great question, particularly for clinicians, because as we know, a lot of the signs and symptoms of hypothyroidism are non-specific. Some of the most common signs and symptoms we see are related to metabolic slowing due to the insufficient thyroid hormone production, and these include fatigue, weight gain, cold intolerance, constipation, low heart rate, and cognitive impairment.
Estimates suggest about 1% of the U.S. population used methamphetamine in 2023. Dr. Led and colleagues wrote a helpful insights article on methamphetamine use disorder that includes information about medical symptoms, treatment, and harm reduction. And Dr. Robinson and colleagues conducted a multi-center trial about MM120, the oral form of LSD, for general anxiety disorder. They randomized patients to receive 4 different doses of MM120 or placebo and found that a single dose produced a dose-dependent reduction in anxiety.
The accompanying editorial by Dr. Soares explains how this trial contributes to emerging research about the potential therapeutic benefits of psychedelic substances.
And the patient page this week is on paternal perinatal depression. About 10% of fathers worldwide experience this mental health condition, and it is not always recognized.
Before we wrap up, keep in mind the latest articles in clinical medicine, biomedical research, public health, and health policy written and researched by our outstanding JAMA Medical News team at jamamedicalnews.com, or you can click on the link in the show notes.
Thanks, Preeti, and thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Linda Brubaker. This episode was produced by Shelley Steffens and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode show notes. And to follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.